Hello, in this video I'm going to demonstrate the process of synchronized cardioversion. In this scenario, we are not focusing on primary assessment, and this is only a simulation. So you may see me omit certain steps that would otherwise be done in your primary assessment or even your secondary assessment. So we're only focusing on the skill of synchronized cardioversion and briefly discussing it. So won't you join me in the ambulance for this simulation? Hello. Welcome to our training ambulance. Before you begin this skill, you want to make sure that you have all the appropriate equipment. For this skill of transcutaneous spacing, you will need to make sure that you have your cardiac monitoring, appropriate ECG electrodes, pacing or defibrillation pads, appropriate oxygen delivery device, and any medications you may need or suspect you may need for sedation prior to cardioversion. So as we begin this simulated exercise, you may see me skip some steps that otherwise would be established in your primary assessment. So again, keep in mind that this video is only to demonstrate the skill itself and the process of performing this skill. We are not discussing specific energy settings, and we're not discussing patient complaints or their primary assessment or their secondary assessment. So anyway, join me for this simulation experience. Miss Jones? Miss Jones, can you hear me? Miss Jones? If you can hear me, wake up and talk to me. Jones, if you can hear me, I'm going to put some sticky pads on your chest, okay? I need to take a look at your heart and see how it's doing. Your heart rate's really fast. I need to see what's going on. Does anybody know if she's allergic to anything? I don't see any med alert tags or any information that may tell me otherwise. Miss Jones, your heart rate is really fast. So we have oxygen being administered. I'm going to get her getting 94%, and that's with oxygen. So we're going to attach our defibrillation pads because I suspect we need to cardiovert. Miss Jones, I'm going to put these pads on your chest, okay? I'll have to give your heart a little shock. Just try to get it going back to normal rhythm. So our blood pressure is 86/54. Our patient is altered mental status, hypotensive. I do not suspect she is hemodynamically stable. So we're going, and we have sinus tach on the monitor. Rate is at 200. So we're going to perform synchronized cardioversion. So we will press the sync button. We need to make sure that all of our QRS complexes are being recognized by the monitor. We're going to set our fibrillation settings. For narrow complex, we're going to start at 50 joules. So we're going to set our energy setting at 50 joules. Charge that. Make sure no one is touching the patient. Oxygen's been cut off during delivery. Everybody clear? shock delivered. We're going to reassess the pulse. Still have a pulse. Patient is still in sinus tach. Patient still presents to be hemodynamically unstable. We would continue the synchronized cardioverting, or we may go to other means to verify or until we get conversion of that tachyarrhythmia. Patient still presented as altermental status with hypotension. We would continue to increase our energy setting of our defibrillation dose at synchronized setting, and then may go on toward other pharmacological interventions if needed. So for the purpose of this skill, we want to slow the patient's heart rate down. And we would do that by delivering a defibrillation, a controlled defibrillation at a specific time, known as synchronized cardioverting. So in this case, our patient was in a narrow complex tachycardia suspected to be sinus tach. For those energy settings, American Heart Association truly recommends utilizing the manufacturer's recommendation. And those vary based off of LifePak or Zoll. So if you're unsure about those, American Heart in their ECC guidelines has suggested to go back to our 2010 guidelines, and it was reaffirmed in a 2015 ECC guidelines of narrow complex tachycardia, 50 to 100 joules. Narrow irregular, so somewhere like AFib, is 100 to 200 joules, and those are in biphasic settings. If you have a wide complex tachycardia, so VTAC with a pulse, you want to start your energy settings at 100. And then for a wide irregular rhythm, so something like torsades or polymorphic VTAC, we cannot synchronize cardiovert that. We would deliver a regular defibrillation dose starting at 200 joules biphasic. Notice what we had done. So again, with this scenario, we did not focus on primary assessment or truly patient assessment at all. This skills and this video is only to demonstrate the process of synchronized cardioverting. So when you do synchronized cardiovert, make sure that you are pressing the sync button on your defibrillator. Now this location may vary whether or not it's a LifePak or a Zoll or MRL, any of those other brands. So synchronized cardioverter, you're going to press the sync button. You want to recognize that these QRS complexes are being recognized. You want to select the appropriate energy level. In this case, it was narrow complex tachycardia, suspected to be sinus tach. So we started our energy setting at 50 joules. We charged our defibrillator. We'll make sure nobody was touching the patient. Everybody was clear. We have oxygen delivery device stopped, or because we don't want that high concentration of oxygen in the area where there may be sparks. So make sure everybody was clear, nobody was touching the patient, oxygen was off, and then we delivered our synchronized defibrillation. And as we further into your paramedic education, you'll learn more and more about what are the next steps, what's your initial steps, and then if that doesn't work, what's happening next. So hopefully this skill helps you to understand the kind of the process of it, and so gives you an opportunity to put your knowledge to use.